Hi everyone, my name is Karemi Alvarez, and it's a pleasure for me to be here and to be a part of this amazing online summit. Thank you for having me. Today I'm going to be speaking with you about how you can speak with young children about death. Some examples of things you can say, conversations you can have to make it a topic that is digestible for them and one that they can process and in a way that isn't going to be internalized for them as a scary topic. So before I start, I'd like to introduce myself. I'm a conscious parenting coach. I'm certified by Dr. Shefali Tsabary's Conscious Coaching Institute. I have a master's in public health from the University of California, Berkeley, where I had the opportunity to not just learn about physical health, but also the mental health aspects, specifically about underserved communities and communities of color. And I worked for several years in the Department of Pediatrics at UC San Diego. And through that work and through my personal life experiences, I became very passionate about working with children and addressing their emotional health and seeing the link that it has with their parents' mental states. And so I became a certified conscious parenting coach. Through my practice, through my work with parents, I help them to connect to themselves and to connect with their children and to create an emotional environment in their home where they can enjoy, they as well as their children, where they can enjoy mental and emotional health. I also have a podcast. It's called The Emotional Inheritance of Parenting. And in the podcast, I share with parents tools and knowledge that they can apply in their everyday lives to create a home environment of mindfulness, of emotional presence, of approaches that are different from traditional discipline. And lastly, I work with schools as well. I provide in-person and online trainings for teachers, specifically kindergarten, preschool level, and also daycare centers, so early childhood specifically, but I also work with other grade levels as well. So I'm going to get started. So let's equip ourselves with some knowledge about how we can best show up for our children when they come to us with questions or with worries about death. And specifically, when I say young children, I mean ages 0 to 7, 0 to 8. So first off, it's very important for us to have a clear understanding of how we view death. Because even if we hear something that, oh, maybe I could say this to my child, or oh, I could say that, or a combination of these two things, what matters most is that we are going to transmit to them how we view it. The way that we approach this topic is absolutely going to get transmitted to them. Now, this doesn't mean that we have to have all the answers. Nobody does, and it's perfectly okay. But how we understand death, what conclusions we have come to, be it as a result of a faith that you practice or as a result of just your own understanding that you've developed throughout life, how we view it as parents is going to get transmitted to them in the way that we respond, in the way that we feel, in the way that we live our lives. So that is the most important thing to keep in mind, is how do we approach this topic? It's important to help our children to feel that they can come to us with any questions or worries or fears that they have about this topic, and to not distract them from it, to not try to push away their pain or to distract them when they bring up questions about death in order to help them feel less fear or less pain around a topic like this. So in order to help them process any questions that they have or pain that they may be feeling, if perhaps a family member has just passed away or a friend or a pet has died, it's important for us to do something that Dr. Daniel Siegel recommends. Dr. Daniel Siegel is a world-renowned neuropsychiatrist. He has written many books around brain development in young children and in children in general, and how we can best communicate with children in a way that is aligned with their developmental stage. So I highly recommend that you get his books and read them. He has written many along with Dr. Tina Payne Bryson. So what he recommends, and this is something that is also aligned with the research, of course, is that it helps to invite our children to tell the story of what happened. If they understand what happened with a family member or with a pet, and if they don't yet, then we tell the story of what happened. And we can do this through the use of stuffed animals or puppets, like hand puppets, because it makes it more understandable and digestible for young children, rather than us using our long sentences and, going on and on the way we do when we communicate with other adults. Children's attention span and their way of understanding is much better when we can tell a story of what happened. So, for example, you can describe the events that occurred, and not just the events or say, for example, their bunny died or their dog or a family member, things that you can describe as to what happened, but also the feelings that somebody was feeling along the way. This is very recommendable because when you describe something that's very difficult to process, in this case, death, and you describe it in a way that is like a story, children are much more likely to be attentive, to pay attention, and to ask questions the way they would if you were reading them a storybook. If they were watching a movie, they would just go, "But why did this happen? And what about that?" So it's important to tell the story of what happened and to pause if they have a question, and then rewind the story, go back if they didn't understand something perhaps. And if they want to ask something and have something repeated, or have you go a little further as to how it ended, and then you can come back to the beginning and describe the whole process, it's important to go with their lead, because this helps children to integrate their fears with a verbal understanding. So something that is key here, and that Dr. Dan Siegel describes in depth. I highly recommend you peruse his books, when you have the time. But something that is very helpful in terms of why tell a story? Why not just talk about it? Why make it a story, through the use of puppets or stuffed animals? It's because I'm going to get a little technical, but it'll be brief. So in our right hemisphere is where we process a lot of the emotions, where we sense nonverbal language. So if a child's fear and emotions are really strong and around, or anxiety around the topic of death, and they don't understand what's happening, we come in once we've helped a child to calm down and we've connected with them, be it through a hug, an empathic look. So we don't just directly go to verbal explanations. We connect with a child. We help them to, we can become a soothing presence for them. And once they're ready to talk, a verbal explanation is very helpful, because in the left hemisphere of our brain is where we process a lot of the logic, a lot of the verbal communication. And so what you're literally doing when you explain to a child through the story of what happened, what you're doing is you're helping the child to integrate both hemispheres of their brain, all the feeling and perhaps concerns or what's going on for them emotionally, with a verbal understanding. Now, this helps children to process the topic of death, be it of a family member or a pet or someone close to them that has passed away. One important benefit of telling the story of what happened is that you are describing this very challenging topic at the child's own pace. You are talking about it, you're describing it, you're rewinding, you're pausing for questions, and you are letting them take the lead in terms of what they want to know more about, what expressions they're showing you. So it helps them to process it and to gradually understand it. This helps children to process their fear and to not have all those fears and all those, emotions, maybe anxiety or concern stuck inside of them. Now, if you yourself are grieving the death of a loved one, if you are going through intense emotional pain while your child is trying to understand all this, then it could be it could be very difficult for you to have a conversation with your child. So be patient with yourself, have compassion with yourself, that you won't always have the emotional disposition to do this. So find the time for yourself as well. But once you've been able to sort of sit with yourself and just be on your own, grieving, try to find the time to speak with your child or with your children about this, because then it won't become a traumatic topic for them. It will be one that they will be able to process with the understanding, with the emotional container of your presence, and with your explanations as well. One thing I'd like to clarify is that under the age of 3, children really won't be understanding the concept of something dying, the concept of something no longer existing in the physical form. So I wouldn't recommend that you have these kinds of, conversations with a child under the age of 3. They really wouldn't understand it. But starting at the preschool age, starting around the age of 3, children can begin to ask questions and be curious and be able to hear at least a little bit of what has happened, say to a family member or a friend. So it is important to take that into consideration. So let me give you an example. Let's say you have a 3-year-old son or daughter, and they were very close with their grandfather, and their grandfather has passed away, and they're asking about him. Where is he? When can I see him? What happened to him? So one thing that you can say to them that is clear that they can gradually begin to understand is something like this. Grandpa was very old and very sick. His body stopped working and it shut down. When a person's body shuts down, it means the person has died. Stop there. See if they have any questions. Rather than continuing to say things, just stay there and see what your child has questions or concerns about so you can follow their lead. If your child asks, what's going to happen to him now? So they're curious, they don't quite understand what it means to have died. You can say something like this. Grandpa is dead. His body shut down. It stopped working. He was very old, very sick, and that means that it shut down and he died. That means he won't talk anymore, he won't walk anymore, we won't see him anymore because his body is dead. Now, if you decide to share with your child, whether they're 3, 4, 5 years old, if you decide to share with them that perhaps if what you and your family decide to do is to bury the body, if you decide to tell them that that's what's going to happen with the body and they ask, what's going to happen to him? You can say something like this. Grandpa won't feel anything because he is dead. The body is like a home where Grandpa lived. And since the body's dead, and Grandpa is no longer there, he won't feel anything. You will see that his beautiful, laughing, loving spirit isn't there anymore. We're just burying the body. So you can remind your child that Grandpa isn't present in the body anymore, and the body isn't going to feel anything. So one thing that's really recommendable is, and this is a recommendation that Dr. Laura Markham gives. Dr. Laura Markham is a clinical psychologist. She has written several best-selling parenting books. I highly recommend that you read her books. They're so helpful. And one thing that she recommends is to allow the child and maybe even encourage your child to talk about the person that has passed away, to talk about what they loved about the person. And even if it's something that brings up tears or brings up laughter in the memory of the person, whatever it is that comes out in conversation, allow it, even encourage it. Not to pressure your child to talk about the person in an attempt to see how they're doing, but just to let your child talk about the person that has died. And if you want, ask a few questions about how they're feeling. Do they want to share something that they're thinking about in remembering Grandpa? One important point that Dr. Laura Markham raises is this. One of the biggest concerns with young children when they hear that a close person in their lives has died is that they will fear that that person has abandoned them. So in the example of a grandfather passing away and your 3-year-old son or daughter learning about that, the biggest concern, so to speak, or one of the concerns is to make sure that you constantly reassure your child when you have conversations with them about this, that this person that died loved them with all their heart, because young children can feel that this person abandoned them. And so you want to make sure that you reassure your child that this person loved them and that even though they are not alive anymore, the love will always continue. The love continues inside your child's heart. The love that this person gave them when they were alive will always be inside their heart. And so it's very important to reassure them of this so that they don't take it personally. With young children, ages 0 to 7, 0 to 8, they're in a developmental stage where it's all about them. It's very natural. It's very normal. They make a lot of things about themselves. So I'm sure you've heard your children, if you have young ones or if you have older ones, when they were little, it's all about me, my stuffy, my toy, my mommy, my book, me. So the way that it's perfectly natural. It's a very egocentric stage of development. It's just part of development. But the thing is this, they also take more complex things to mean about themselves. So when, for example, we yell at a young child, they don't think, you know what, mom must be in a really bad mood because she's pretty tired. Or, oh, she looks stressed. That must be why she's raising her voice so loudly right now. Little kids don't think like that. They take it to mean something about themselves. Just like with toys, my mommy, my toy, my book. Just like with those kinds of things, even when they are talked to in a certain way, they take it to mean something about themselves, such as, I am a bad boy. I am a bad girl. I am not lovable. I am not accepted. It's all about them. And so we have to be very careful, obviously, at any age of our children, how we communicate, but especially in early childhood, because their sense of self is forming. Their sense of self is developing based on how we treat them every day. And in this case, with death, such a topic that is new to them and just one that they are trying to grasp, if grandpa died, we want to make sure that they know that it wasn't anyone's fault. It wasn't their fault. It wasn't grandpa's fault. It wasn't anybody's fault. Grandpa was very old and very sick, and his body gradually stopped working and then eventually shut down and died. That's why he died. So reassuring young children about this will help them to move on and to understand death better. Now, if your child goes with you to the funeral or to the service or, just to wherever you are getting together with family and friends in remembering the person who has died, if your child sees a lot of people crying and they're asking, why is everybody crying? Why is everybody so sad? They might not understand quite yet what's going on. And so you can say something like this, all these people who are here, they loved grandpa so much and they're really going to miss him. And so they feel really sad that they won't be able to see him again. And so that's why they're crying. And it helps to cry. It helps to let out the sadness and it helps us feel better. So that's why they're crying. Just make it something normal, something that's okay, something that's understandable. And more importantly, try to give answers that are brief, that are specific to the question that they asked, rather than going on and on with an explanation. As adults, I think it's very common that we continue and we go on a tangent and then we are worried that maybe they're worried about something else or scared about something else. And then we go on and give other explanations that maybe they had no questions about. So in general, try to address what they are asking. Try to connect to them emotionally and not overdo the verbal explanation. And when you do give verbal explanations, then make it something that is clear and not too complex for them. Like this, what I mentioned about the crying, just, people are going to miss him. They loved him so much and they know they're not going to see him again. And so they're crying because they're sad. And it helps to cry. It helps to let out the tears. Now, in terms of things that are not recommendable to say, Dr. Laura Markham provides really good recommendations, and I'll mention some of them here. One thing that is not recommendable to say is this, if an animal has died or a person has died, they went to sleep for a really long time. You don't want to give your child fears about going to sleep, because then they're going to associate going to sleep with possibly never seeing someone that they love ever again. And so we want to make sure that young children understand that death and sleep are completely different things. I'm going to be looking at my notes for a bit because I want to make sure that I mention all the things that are important not to say. Also, don't say that a person just went away. They went away. The concept of passed away, went away, young children don't understand it. And so that's one of the things that I was mentioning earlier. It's very important to use very clear language, because young children take things literally. Children in general, but especially young children, they take things very literally. So it's important not to say things such as they passed away, they went away, because then that could develop in them some separation anxieties. If you drop them off at school, or you go on a business trip, mommy went away, when is she coming back? Those kinds of things can come up for them because they don't quite get what that means to have passed away, to have gone away. So it's very important to not use that kind of language with young children. Another important thing to keep in mind with regard to the language that we use with young children is, if you have a particular faith that guides your understanding about death and you want to share that with your child, with your children, of course, but just be careful with some of the language. For example, saying something like, he was such a good person that God wanted him close, or she was such a good person that God wanted her close. It could lead to some confusion for children, for young children, such as, death is the prize for being a good person. And we don't want to create in children an understanding that death is a prize for being good, and everybody defines the term good in a different way. So it could lead to confusion for young children. Another important thing to be careful with is saying things such as, she's in a better place, or he's in a better place. Again, young children take things literally. So they could understand that to mean that being dead is better than being alive because he's in a better place. And so we want to make sure that we don't use language that can be confusing for them. Something that's very helpful for young children, and honestly for older children and for us as adults, is to talk to them about how nature has cycles, and we are part of nature. We humans and animals and plants, we're all part of nature, and nature has a cycle for all of us. You can use the analogy of a plant. If you plant the seeds begin to grow with water and sunlight, and then it can become a big tree, and then in the fall or autumn, the leaves fall and they die, making room for new leaves to grow. And so talking about that cycle, about how everything in nature changes. It's always shifting. It's always changing. And there's always, life, the life of a plant, and then the life of an animal. And then, you grow, you have a life, and then you die. And talking about that, making it for them something that they can understand, that they see it all around, that it's part of us, and that we are part of nature's cycle, can really help them to feel that it isn't something that just happened to them or in their family. It's something that is part of nature. It helps to talk about it, but if you can, to take them out in nature. And as you're walking, and of course nature has such a therapeutic, it's very soothing, it's very helpful, it provides a sense of peace when we're out in nature. Even if we're just hiking, it doesn't mean that we have to go and be calm. Just out walking in nature. If you can do that, it really helps to ground children in terms of their understanding. And you can point those things out. You can say things such as, remember we were talking about nature and how it has cycles. Look at the tree. It's autumn and now the trees are falling, but they're making room for spring when the new leaves come out. And then these leaves that fell, they're going to become, food for other creatures. And so talking about how we're all part of that is very helpful for young children. You can also talk to them about how nature has, just a cycle for all of us, about how we're born, we live joyful lives, and then we die. And so how important it is to enjoy the moment that we're in, to live fully, to follow our passions, to learn, and to help other people or other animals and other plants and just nature when we can, to enjoy our lives and to, live it fully, which young children already do. They're fully immersed in the moment. They live their lives fully. But just to remind them that to enjoy the present moment and to be where we are. in terms of how we live our lives and following our passions and listening to our heart, and just all of that is going to be very helpful for them in terms of transitioning sort of the energy, instead of one being about just, death and cycle and understanding that, to one of, where are we now in our own cycle? We are alive. How exciting. And we're together and we can live our lives and enjoy it and, learn so much. There's so much to do and so many adventures to have. Now, it doesn't mean that you need to have this kind of energy when they're crying, because then that would sort of be like trying to distract them from their pain. And that's not what we want to do. But rather when they have already, brought out the tears and have already, felt calmer, and we're out in nature and we're just kind of in a different mood and we're talking and we're walking, to bring that out. Or even if you're not in nature, if you're at home, and you can sense that they're in a different emotional state, they're no longer in the deep, grieving, but rather they're just more open to talking and to being playful. That's when you can, if the topic comes up, you can say something like this: isn't it amazing that we're so alive and that we're healthy and that we have so much to do and learn and we're together? That's when it's important, because then it shows that sort of appreciation and gratitude for what we do have. One important thing that I'd like to clarify is that all these recommendations about what to say, what's not recommendable to say, how to say it, like such as telling the story of what happened and using the stuffed animals, and activities we can do with our children, such as, and I didn't mention this, but like drawing something that they might remember about the person, or the activities out in nature, the analogies, all of these recommendations, they're not intended in any way to have the goal of taking our children's pain away in terms of their grieving. Our children, just like us and any other human being, have every right to feel the pain of losing a loved one, be it a family member, a friend, a pet that they loved. It's very important that we not take these recommendations to mean that they're going to help us take our child's pain away. Not at all. These recommendations are intended to help a child gradually understand what death is. Such a new concept for a young child. They are intended to help them process all the feelings that are coming up for them with a gradual understanding of what it means to die, that a person or an animal is no longer going to be with us physically. We won't be able to see them. So that's what these are about. It's important for us to keep in mind that the most important thing isn't the verbal explanations that we provide, or the examples, or the analogies. They're great in terms of providing an understanding, but the most important thing here is that we allow our children to feel what's coming up for them, that they know that it's okay to feel what they're feeling, that we not try to distract them from it. Because what they would take from that is that feelings can be so scary, such as death can be very scary, or the fear of it, or the concerns about it, or the anxieties around the topic, that it's so much that mommy and daddy want to distract me with some ice cream, or with turning on the TV, or with let's go out and play. They internalize the message that feelings that they don't understand and that are, anxiety provoking, they are very scary. And it's when something scary comes up for me, I should avoid it. That's what we're implicitly teaching children when we don't help them just be with their feelings. And sometimes as parents, and I can totally understand this, sometimes as parents we worry, oh my God, my child is in so much pain. She or he is crying unconsolably, or just, we don't know, I don't know what to do. I want to help her feel better. And that's completely natural. As parents, we want to help our child feel better, yes. But here's the interesting thing. One of the best ways that we can, one of the most important things we can do to show up for our children when they're in so much pain is to be with them in their pain. Not to try to take it away from them and explain it out, but rather to just sit with them, to hug them, to say something such as, I know how hard this can be for you. It's okay to be sad. It's okay to feel confusion about what happened to so-and-so or to their pet. I'm right here with you. It's okay to let the tears out, to let all that sadness out and to feel it. You can even say something like, I'm feeling sad too. If you want me to be with you, I'm right here. You can talk to me. That's it. And let that process happen. As you know, there are stages of grief, the 5 stages of grief, and we don't reach the last one, which is acceptance, unless we've been allowed to feel all of these. So it's important for us to understand that young children go through their own processes as well, and that one of the best ways for them to move through them and not get stuck in them is for them to have a nurturing, caring adult to serve as an emotional container. That's the most important thing. And then when they're ready to take a break from crying and to just kind of talk, that's when all these recommendations come in. That's when it helps to tell the story of what happened, to again make it like a story and rewind so they can understand something that maybe they didn't quite get and answer their questions. That's when all of that becomes helpful, because we've helped them to integrate verbal understanding with emotional feelings. But we first want to let those feelings be there. We don't want to explain them away. We want to be with them in those feelings. Sometimes, and maybe this has happened to you too, sometimes you just want somebody who's with you as you're crying to just hear you and say, my God, I think I can only imagine how hard this must be for you. And that's it. We don't need someone to always be explaining things away, especially very, difficult and confusing ones. One thing that I want to say is that I can understand that many parents could feel concerned that the topic of death could become traumatic for a child if someone really close to them has died. And here I'd like to share with you a quote from Dr. Gabor Mate that I feel explains trauma beautifully. If you are concerned with, the topic of death becoming traumatic for your young child, if you talk with them about it, or if they've been through experiencing the loss of a loved one, I'd like to share a quote from Dr. Gabor Mate that I think can really help you understand it. And I'm going to read it. It says this, quote, "Trauma is a psychic wound that hardens you psychologically, that then interferes with your ability to grow and develop. It pains you, and now you're acting out of pain. It induces fear, and now you're acting out of fear. Trauma is not what happens to you. It's what happens inside of you as a result of what happened to you. Trauma is that scarring that makes you less flexible, more rigid, less feeling, and more defended." End quote. So you can see that even though we can't control what happens in our child's lives, what happens in our children's lives, even though you can't control whether somebody in their life dies or a pet that they love dies, what you can control is how you respond to that experience. What narrative, what description you give to them during those difficult moments. That is fully under your control. How you live that experience and how you help your child to process it. The description, the narrative that they walk away with will be so influential in terms of how they understand death. So even though you can't prevent something happening in terms of what happens in their lives, in terms of death, you can absolutely have in chargeness in terms of how you show up emotionally, being there for them, having the patience to answer questions that they have repeatedly. They very likely won't just have 1 or 2 questions on the day of the funeral or on the day of, in which they found out a person died. Maybe it'll be days and weeks. That's their way of processing it. If they're playing and all of a sudden they ask, "Mommy, but what did you say about this?" Or when you're, putting them down for bed, "Mom, what did you say about that? I don't understand," or "I'm scared." It's going to be, continuous. It's going to be a process to help them understand it. But that's where you can show up. That's what you have full control over, how you show up for them, the patience that you have with them in terms of answering a question they have many times or telling the story again. That's how they, at their young age, are trying to process and understand everything that happened. And it will help them to not have this topic of death be traumatic for them, but rather one that was, yes, painful, yes, understandably, but that they got through it, that they came out of it with more understanding about life, about themselves in the world as part of nature, about their relationship with you. They came out of this experience knowing that mommy and daddy are there to help them feel safe, to help them understand difficult things when something happens. That's what you want them to walk away with. And I just want to reiterate, as Dr. Gabor Mate describes, it's what happens inside our children as a result of what happens to them that determines whether something becomes traumatic or not. And that's the very powerful role that we have as parents, is how we help them process things that are very challenging. One last thing that I'd like to mention is that with regard to helping our child face this difficult and challenging topic of death in a way that is tolerable for them and, in a way that they can come out of in a healthy way, is the distinction that the Harvard University Center on the Developing Child makes with regard to the differences among toxic stress, tolerable stress, and positive stress. And if you'd like to learn more about this, you're welcome to check out my episode. Again, the podcast is The Emotional Inheritance of Parenting, and episode 19, where I describe in detail and examples the difference. But the death of a family member or a loved one or a pet falls under the tolerable stress. Again, from the Harvard University Center on the Developing Child. But what they describe is that in order for this kind of experience to be tolerable and not, toxic in terms of how they live it emotionally, what matters most is, and I'm going to share this, it can only be tolerable for children if they go through this kind of experience for a limited time and with the support of a caring adult. So of course, the death of a family member or a pet isn't something that's going to go on forever in terms of having learned about that death, but rather it goes for a limited time in terms of the experience, the grieving, and they have a supportive adult, a caring adult, a nurturing adult that helps them to understand it, to talk about it, to ask questions. I want to share something that is a personal story that I only recently shared publicly, and I want to share it with you because I think it can be very helpful. When I was 5 years old, I lived in Mexico City and I almost died. I developed a disease that affected my kidneys and I had to spend a month and a half in the hospital. And I was very close to dying. The doctors told my parents that I wasn't responding to the medication and that there was nothing else they could do. My parents were getting ready, for me to pass away. And the doctors told them that unless the medication, that I finally responded to the medication, I was going to die. So I went through this experience at the young age of 5 in Mexico City at the time, in that particular hospital anyway. Parents weren't allowed to be in the same room with any patient. I never saw my mom or my dad in the hospital room. So I felt very scared and very alone, very lonely. 2 sick patients died right beside me. Only a curtain divided my bed from the other patient's bed. And it was a very, very traumatic experience for me because nobody helped me to process what I went through. Nobody talked to me about it, neither in the hospital nor when I finally healed and left the hospital. So what I walked out with from that experience was that I was very sick. I almost died. The nurses mentioned, you could die. If you don't let us do these tube things, you could die, because I was so scared. I was crying. I didn't want any of that to happen. My mom wasn't there with me. My dad wasn't there. 2 patients died right beside me. I had all these tubes in my body. And it was a very lonely experience. And when I came out, nobody talked to me about it. And one thing that my dad said to me that really contributed to my fears around getting sick, and this isn't to blame my dad at all. None of it is to blame parents, but rather to understand, the process that sometimes we go through as human beings when we're stressed. He said something to me when I finally was back home. He said, "Close your mouth. close your mouth. The doctor said that the disease went in through your mouth. So when you're out walking in the street, close your mouth. So at the young age of 5, I couldn't understand, obviously, that my dad was coming from so much stress, from so much overwhelm about what he had been through, that he almost lost a daughter, that he was just trying to do everything he could to keep me safe so I would never go through this again. I didn't know that. I just took all of that to mean life is dangerous. You can get sick from anything you breathe in, and if you have your mouth open, if you get sick, you could die, and getting sick is very, very lonely and scary. That's what I took from that experience. I even remember that when I came back from the hospital, I would have my mom sit in bed with me, and I would tell her, if you, as I'm falling asleep, if you feel my heart, put your hand on my chest, and if you feel it stopping, shake me so that my heart starts beating again. That's what, at the young age of 5, I thought would help me. But you see, I developed all these phobias around getting sick and around dying and around, just being alone. So what I mean to say with this personal experience that I hope helps you is that young children, when something that is very difficult or scary isn't talked about, when it's not processed, they can internalize it in a traumatic way. As I mentioned earlier, it's not what happens necessarily, but rather how it's processed. Obviously, there are things that can become traumatic just, for the fact that they're happening, abuse, etc. But what matters most when, we talk about death, or if someone dies as a result of an illness, or even in my case when, I was going through a serious illness, it's so important to talk with children about it. Now, not in the way that, my dad did, close your mouth. That's just a projection of parents' fear. But rather, how are you feeling? And in here, the example of telling the story of what happened, in my case, it would have been so soothing, therapeutic, and helpful for my parents to have said, this is what happened. We weren't able to be in there with you, but what was happening for you? What did you feel when you had, to take this medicine? I remember you had to take a lot. How were you feeling? So not just telling the events themselves in the chronological events, but what were the feelings that were coming up for your child? And you can also say what was coming up for you. Something like, I was very, scared, not scared, but rather I was worried, but I knew that the doctors were doing everything they had to do to help you feel better. Or with regard to the death of a loved one, yes, it is painful for me to not see grandpa anymore. It is painful for me to know that I won't be able to see him, but I loved him so much, and all the love that he had for me is inside my heart, and it will always be there. And I remember him with, I have such beautiful memories, things like that. And in closing, I'd just like to say as a, conclusion that one of the big takeaways is with regard to talking with young children about death is, again, how are we approaching it? How do we feel about it? Because we are absolutely going to transmit this to our children, no matter what perfectly packaged answer we give them in terms of a verbal response. Also, to not shy away from having the difficult conversations, because we don't want to transmit the message that it's better to not talk about difficult things, or it's better to not talk about scary things. Let's just kind of, distract ourselves with a game or with food, or we don't want to transmit that message. We want to show up for the difficult conversations as well, with patience, with obviously a lot of self-care. If you yourself are grieving, it's so important for you to take care of yourself as well. And, show up if your child has a question when you feel ready to have that conversation. If you're not ready, you can say, what, sweetie, I really want to answer this. Let me just, I'm just going to go to the bathroom. If you need a few minutes of space for yourself, or let's talk about this in a few minutes. I just have to do this right now, and do come back after a few minutes, because that question is going to sit in with them until they've resolved it. So not shying away from the difficult conversations. It's important that we explain it in a story, in a way that they can understand. Again, the use of puppets. You don't have to, you can just have a conversation, but just do keep in mind to keep the answers short, to keep them very, clear in the language that you use, to answer only what they're asking and not more. We don't want to confuse them with more information. And to help them know that you allow the pain to be there, the pain that they're feeling, that you're there and sitting with them through that process. And lastly, I'd just like to say that as part of this presentation, I created a list of books that you can read to your young children. Leah is going to include that as part of this presentation, and you can, I think it's going to be sent to you, I believe, or if not, you can absolutely ask her to send it. But it's a list of several books that you can read to young children about death. Some of them are about the death of a person and some about the death of an animal. But these books are great in the sense that they don't make the topic scary or confusing, but rather it helps young children understand death in a friendly way, in a very simple way, and it helps for it to be a starter in terms of a conversation for you to have with your child. Thank you so much for listening to this presentation. I hope you continue to enjoy this amazing online summit, this online retreat. I am so grateful to have been a part of it. Please feel free to reach out to me if you have any questions, be it about this particular topic or about conscious parenting in general. You can visit me at coachkaremi.com, Karemi with a K, coachkaremi.com, or you can follow me on Instagram at Coach Karemi. Thank you very much.